Hi, and welcome to the TRT-Train. My name is August, and today I'm going to talk about the blood tests you need to do to correctly diagnose testosterone deficiency or hypogonadism. The first thing you want to check, of course, is your testosterone level or total testosterone, also called the blood serum testosterone. That is the total amount of testosterone available in your bloodstream after your body has produced it. The second thing you want to check is your SHBG or sex hormone binding globulin. That is a protein that binds to your testosterone and transports it through your body and protects it from the liver. It is the liver that produces SHBG, and you can have too much or too little, and it may result in castrating effects for the man. The next thing you want to check is albumin. It's also a protein that transports, among other things, testosterone and estrogen. We say that testosterone that is bound to albumin is bioavailable because even though it binds to testosterone the same way SHBG does, it binds less strongly, and the testosterone is available to be released within a split second when passing through a receiving area. So it's bioavailable. And you need albumin to calculate the total or the free fraction of your testosterone, which is usually about 2 to 3% of the total. The next thing you want to check is estrogen. Estrogen for a man is the flip side of testosterone. It is produced of testosterone by the aromatase enzyme. And if your estrogen is off, then probably something's up with your testosterone as well. The next thing you want to check is your PSA level, or a prostate-specific antigen. The number you get from this, or the value you get from the blood test, doesn't necessarily tell you anything the first time, but it's a reference point, and when you check again later, it can be a good indicator if something's up with your prostate. You should also be checking your FSH, or follicle-stimulating hormone. That is a signaling hormone that's sent from your pituitary gland down to your testicles to produce sperm. It doesn't directly relate to testosterone, but it's sent from the same pituitary gland, and it is relevant for many men to find out what their sperm quality and how the signaling strength is. The next thing you should check is your LH, which stands for luteinizing hormone. It is produced in your pituitary gland and transports downstream with your blood to your testicles, and specifically to the Leydig cells, which are your testosterone-producing factory. And this is where it's nice to know that there are two main categories of hypogonadism or testosterone deficiency, or pathological testosterone deficiency, and that is primary and secondary hypogonadism. The primary hypogonadism means that it is something wrong with your Leydig cells and they're unable to produce testosterone even when your pituitary gland asks for them to produce. The secondary kind of hypogonadism means that there's nothing wrong with the Leydig cells, but it's actually something wrong with the signal strength from your pituitary gland to your Leydig cells. So your testicles are able to produce enough, but it doesn't because it doesn't receive the signal to do so. The last thing you should be checking, and is also important, is vitamin D. Vitamin D has many similar symptoms when you're deficient as with testosterone deficiency. For instance, you will probably be getting fatigued and brain fogged, and it can have a whole host of similar symptoms to testosterone deficiency. So having the value of your vitamin D is important when checking for testosterone deficiency. Those are the values that I recommend you check when checking for testosterone deficiency. I have a host of other articles, among them a quick reference handbook for the beginner on TRT, which guides you through what blood tests to take and your first doctor's appointment. Please check it out at TRT-Train.com, and like, subscribe, and please share. It helps me a ton, and see you again next time. Bye for now.